Well, we now have Professor Julia Sanders, who I'm delighted that she's with us this evening. She's a midwife, as you know now, and a nurse, a researcher and professional leader. She has a joint post between Cardiff University and Cardiff and Vale University Health Board, and she really does bring research into practice, as she's already illustrated. She's the chief investigator for a funded pool study, which is due to complete this year. So I'm sure we'll hear about that later in the year, perhaps. And she's recently completed this newly published WRISK study into users' experiences of COVID-19 maternity service changes. And that's a Cardiff University stroke BPAS project supported by the Wellcome Trust. So, and a really important piece of work that's come out. So I'm really so pleased Julia can share that with us this evening. So welcome, Julia, and the screen is now yours.
Thank you. Thank you. I'll just check they're working. Yes, so thank you, and thank you so much, Mark, for your talk. And I think we really need to remember the role of fathers and partners and the wider family. Oh, can't you? Sorry. Let me go back. I think I just popped my PowerPoint up rather than sharing them. Share screen. Let's try that. Share. Here we go. Let's try this one instead. How does that look? Does that look better? Lovely, thank you. So what I'm going to share with you this evening is the results of a survey that we conducted looking at women's experiences of socially distanced maternity care. This was part of a study. The WRISK project was actually funded by the Wellcome Trust, and originally the funding and the main study was to look at women's experiences of public health messaging and how they receive messages about public health, and how as professionals we can better communicate those risk messages with women. But of course, halfway through the project, COVID and coronavirus happened. And we felt that as a team, we really couldn't miss the opportunity to capture women's experiences of this as well. So just to sort of think back to nearly this time last year, the incredibly rapid change that happened to maternity services as a result of COVID-19, and the whole of the NHS in the UK and maternity services suddenly made very drastic changes to their services, and a lot of the family orientated care was actually just wiped away within days. We moved as much as we could to virtual consultations, so women weren't being seen and partners weren't being seen face to face anymore. We actually reduced the number of antenatal checkups and postnatal checkups for women, and home visits were reduced. So perhaps reducing those opportunities for really developing relationships. And importantly, in our hospitals, we severely restricted access to partners and other visitors, so that included families as well. And of course, all these things were put in place with an aim of protecting mothers and babies and staff. And at that time, there was real uncertainty about to the extent to which COVID would hit in the UK. We had no idea how many staff would be affected and be either off sick themselves, needing time off because their family or their child was unwell, or staff that were needing to shield. So these services were being changed really without really knowing how many staff were going to need to be off. We also really had no idea of the numbers of very sick women that we would see, or the numbers of women that were COVID positive that we'd be looking after. And we also there was real fear over COVID, and we were very unsure about the infection control measures that were needed. And also at that time, there were shortages of the protection that we needed in terms of masks, and everyone was very worried indeed. So by the spring sort of came and went, and everyone settled into this new pattern of virtual working and restricted visiting. And so, but by the time June came, we felt it was really important to try and capture women's experiences of these radical changes to the service. We did actually apply for funding to have a broader piece of work which captured partners and healthcare professionals as well. But unfortunately, we didn't get that funded. So we thought, what can we do with the resources that we've got? So that's why the survey was restricted just to women. So we put this out on SurveyMonkey and just asked for women that were either pregnant or had experienced pregnancy care or birth care during the pandemic. So that was since March to participate. So we were asked for women who were over 16 who'd been pregnant and were living in the United Kingdom. And of course, unfortunately, because of the nature of the survey, women needed to be able to communicate in English. We had run the main public health survey the year before and had huge numbers of responses. So we actually, it sounds awful, but we actually kept this one quite quiet. But so we weren't inundated with data, and we just left this survey ticking along quietly on the internet, and we had just over 500 responses. So the women that responded, around a third of them had actually given birth, and the remainder were still pregnant or had sadly lost their pregnancy. Around just under half were expecting their first baby, and as you'd expect, and quite representative, around a quarter of the women had an underlying medical condition, and about 40% of women were also receiving some obstetric care. There's some details here about the participants. Generally, as often is the case with surveys, unfortunately, Black and ethnic minority groups was rather underrepresented. But what was important to us is we were hearing some women's voices, and hopefully they could share their experiences. So firstly, we asked women about just the general social distancing measures in the United Kingdom. Pregnant women had been put in this category that they should practice what was termed stringent social distancing. So that kind of sounded like they needed to do a little bit more than everybody else, but they were never quite defined as a group that needed to shield. So that was a group that were considered very high risk. And the result of that we found really, so just 40% of women said that they actually found that advice quite confusing. And nearly 1 in 5 said they found it very unclear and confusing. So there was real problems with women understanding what is it that I'm supposed to do as a pregnant woman to protect myself. But in public health messaging, one of the principles that's used is it's called the precautionary principle, and that's the same principle as, better to be safe than sorry. And actually, women expressed that they understood that the knowledge about COVID-19 was very limited, that there were lots and lots of unanswered questions about how it would affect people in general and how it would affect pregnant women and their newborn babies. And actually, women appreciated that that caution was to be expected. And this is a quote from a woman who said, I think it's important to socially distance. There just isn't enough data or evidence as to what impact it can have on pregnant women. Unfortunately, a year later, we're much better informed, and we've got much better knowledge about the virus and the disease to know what is safe for women and for staff. And again, I was involved last year with talking to women who had booked for home births, and unfortunately in many areas home births were cancelled. Fortunately in our area that wasn't the case, but I was quite it was quite noticeable that lots of women were actually completely locking themselves away in their homes for months on end because they felt that that was the only safe way to keep themselves and their baby safe. And that's got huge implications for the way that they felt and those feelings of isolation. So women were already feeling isolated, and then we were building in antenatal care that reduced the amount of face-to-face contact on top of that. So we asked women about their experiences of virtual antenatal care, and that by virtual I mean either telephone checkups or using Zoom or using something else. And around half of the participants had experienced one of these virtual checkups with a midwife, and slightly fewer with the doctor. Very few women actually reported that they had trouble with the technology, but that may well reflect the women that actually found and completed an online survey as well. But what was concerning was that nearly 1 in 4 women actually said that they felt their needs were just not met at all by virtual antenatal care. And we really need to consider that. It's very easy for us to embrace this with real enthusiasm and to think that it may be a good way to deliver care. But we now know that actually we'll need to make more of an effort if we're going to do that in the future. And some women, okay, there were very few, I have to say, but some were actually very pragmatic about the whole thing. You know, this is how it is. We've just got to put up with it, and we've just got to accept it. And this woman said, it was nice. It's been nice to sit in the car and wait in the waiting room. Hang on, I'm just going to tell my husband not to put the kettle on 1 second. Oh, he's taking the kettle away, so it's okay. The joys. So this woman, yeah, was quite pragmatic about it, quite accepted that it had to be. But actually, even for women who accepted it, they recognised that actually it was a pretty lonely time to be pregnant. And women also felt they were worried that clinical care was getting missed. So this was a woman who felt that she wasn't getting blood pressure checks at the same rate, she was concerned that preeclampsia may get missed. And that's a really difficult thing to women to accept, to be told at the beginning of your pregnancy, we're going to do this because this is how we feel we can look after you safely and it's important, and then suddenly to have some of that care removed. And that's what we found, real concern amongst women. Another area which caused enormous distress to women and concern was the fact that their partners couldn't be with them at all for any of their pregnancy scans. And at the beginning of COVID, partners had no access to be with their partners during scans at all. And women told us just how distressing that was. It was distressing for women whose pregnancies were going completely well, but it was even more distressing for women who were told that they'd had a miscarriage without their partner support, and also for women who had perhaps previously had a pregnancy loss or had other issues that they really felt they needed their partner with them. But women were told us that was an area of real distress, and I'm glad that has now subsequently changed. But another concern that came across was that actually women who could afford to pay for private scans were going off and paying for private scans. So there was a real, so it was actually the women who were more deprived and less financially stable who are actually suffering more as a result of this. And that really can't be healthy for us. The other thing that was introduced was the concept that partners could join and come into the hospital once their partner was established in labour, so that partners and fathers couldn't be there for induction process or the beginning of labour. So women were needing to come into the hospital in labour by themselves, and only once they'd been confirmed to be in established labour could they phone out and their partner could join them. And again, this was causing real distress, along with the cancelling of home birth services. And in many units, midwifery-led units were also closed as they became COVID areas. Okay. So looking at postnatal care, this was an area in the United Kingdom. Postnatal care always comes out as the Cinderella service. Postnatal care always comes out as the one that gets missed out. And what was really sad was to see nearly 70% of women actually saying they were lonely on our postnatal wards or unhappy, and they felt they needed practical care. And this is something we really need to address. And there's stories there from women who were unhappy with their postnatal care. So what are we going to be doing about this? Well, things have changed. In all areas of the United Kingdom, partners can now go in at least for the booking scan and for the 20-week scan. But it is very much dependent on the hospital. In England, I think there's been more of a move and more of a direction from the chief midwifery officers to want to introduce visiting, but it does vary enormously. So I think we just need to continue to be very aware of these issues, and to say, how can we safely, for mothers and babies and staff, get particularly partners and critical visitors back into our units, and to appreciate that partners are not visitors. They're essential to providing that high quality family-based care that we all want to give. So thank you.
Thanks for watching this video from the Maternity and Midwifery Forum. For more expert opinion and analysis, hit the button below to subscribe.